Good morning. Welcome to the School Psychology Review Zoom webinar focused on addressing youth suicide through prevention, intervention, and postvention. My name is Shane Jimerson. I'm the incoming editor of School Psychology Review. Super enthusiastic to host this special Zoom webinar here this morning or midday, depending on where you're at. For those who are active on the various social media, and especially on Twitter, you'll note that we are sending out some of the slides during our presentation. Each of them will be listed as hashtag SPR Zoom Now. And so if you're someone who wants to forward those, reply, retweet, or share information, please do so. Also, if you have questions that come up during the time, feel free to type your questions into the chat. We'll have a bit of time during the presentation, especially at the end, in order to address questions that you might want to hear more information about. So again, I want to highlight that this will be focused on the special topics section that's forthcoming that will be featured in School Psych Review, which we're encouraging individuals to submit manuscripts focused on addressing youth suicide through prevention, intervention, and postvention. And we'll be providing a bit of great information today here with our panelists, which we'll introduce in just a moment, including Dr. Rhonda Boyd, Dr. Dorothy Espelage, and Dr. Tyler Renshaw. So you'll see they'll each provide a little bit more information about themselves. But again, if you do want to retweet or share information or post on Facebook or Instagram, you're welcome to use screenshots and information as we're going forward. We are recording the session and we'll be featuring it on our School Psychology Review YouTube channel. Okay, so with that, let's go ahead and share a little bit more information. As I mentioned, there are multiple special topics that are being featured in School Psychology Review, and the journal has identified multiple important topics, this being one of those, of which you can find out more information simply by putting in Taylor and Francis School Psychology Review, and you'll be able to find the Addressing Youth Suicide Prevention, Intervention, and Postvention call for papers right at the top of that website. Also, I just wanted to note that it has been more than 10 years since the last special series on suicide was featured in School Psychology Review. Some of you may recall that, the information there that was presented by the guest editors, Dr. David Miller, Dr. Tanya Eckert, focused on youth suicidal behavior and included some really great commentaries related to prevention as well as intervention and postvention. So for those of you who have not had an opportunity to look at those, you might check that out on the School Psych Review website. Okay, so we can go ahead and do brief introductions. I'll turn it over to Dr. Dorothy Espelage to share a bit of information about her background.
Great. Well, thank you, Shane. I am Dorothy Espelage from the University of North Carolina at Chapel Hill, and I'm honored to join Rhonda, Tyler, and Shane in what is a very critical topic. Currently, we have just completed a randomized clinical trial where we are evaluating an evidence-based program for suicide called Sources of Strength in 20 high schools with 6,000 kids. So we're currently analyzing that data that take a risk and protective factors of trying to improve school connectedness, which would be a great topic for anyone that would want to submit manuscripts. In addition to that, we're funded by NIMH now to do an integrated data analysis to combine 20 trials to evaluate the extent to which school-based programs are effective in reducing suicide for gender and sexual minority youth. So we're in that space. We're concerned about the public health crisis that we have, that of youth suicide. And so I look forward to seeing your manuscripts.
Thank you. I want to just keep going there, Dr. Boyd.
Hello.
If you just want to briefly introduce yourself, that's great.
Yes, I'm Rhonda Boyd. I'm at the University of Pennsylvania and the Children's Hospital of Philadelphia. One of my roles is I'm the associate director of our child and adolescent mood program in our outpatient clinic, in which we also have a data registry of our patients who come in. One of the things that we had noticed is that a lot of our youth who had depression were exhibiting a lot of suicidal ideation and attempts. And that's what led us to expand our clinical and research to focus on suicidality in this population. And so we began to look at and partner sort of what are the risk factors for suicidality in these youth in order to prevent suicide completions. One of the things that I recently have been involved with is the Congressional Black Caucus Emergency Task Force on Black Youth Suicide and Mental Health, in which I was a work group member, and we also wrote a report that was published in December, and it's on the website of the Congressional Black Caucus.
Thank you. And Dr. Renshaw.
Hi, everybody. I'm Tyler Renshaw. I'm an associate professor of psychology at Utah State. I'm the current director of our school psychology EDS and PhD programs here. And my connection with this topic is at a couple levels. My background interests have always been in school mental health broadly and just across the spectrum from screening to prevention to intensive intervention. And this has become an increasingly common and concerning topic in the work that we do. I supervise a team of about 10 grad students in a school mental health partnership with local districts. And we find ourselves putting more and more effort into suicide prevention work. And it's led us to also focus the research we do in our lab more and more on this topic. The types of studies that we currently have going, which have really been motivated to by my grad students. So shout out to them. I can't see if any of you are the 300 plus in this list, but specifically focused on suicidality and factors that predict and contribute to this among sexual minority youth in schools. So really glad to be here and happy to be on the same team with Rhonda and Dorothy and Shane on this.
Excellent, and great to see each of you. Brief introduction for myself. I am a professor here at the University of California in Santa Barbara, and I'm in a department of counseling, clinical, and school psychology. I focus on really trying to promote the social, cognitive, as well as academic competence of children within the school context. Certainly have placed a lot of emphasis on bullying and victimization, promoting social emotional learning, and addressing mental health needs. Also, an intersect here with this particular topic is my work focused on those areas, but also on school crisis prevention, intervention, response, and postvention, as it often relates to individuals who have chosen to do harm to themselves or others, and the impact that has both within their families as well as the school, for students, for teachers, and others. So critically important topic. I've also done books on depression and such, and that intersect there as well, again, with the mental health. So certainly this is a critically important topic. Here we are within September, Suicide Awareness Month, focusing on suicide prevention. And we have some really great information that our distinguished colleagues will share. I'll keep things flowing forward. I want to give a brief highlight with over 320 folks already participating in the webinar. For the basic poll that was posted at the beginning, those of you who came in early, we see that there's about 40% students. So, hey, students are the future. Great to have you here participating with us today. Practitioners are about 35%. So we've got a great number of practitioners, those that are making the difference every day, working directly with children, youth, families, community members, and such. And then we also have about 10 to 12, 15% faculty members, those out there that are focused on doing the research and such. We have a couple of administrators and a few others as well. So I just wanted to sort of provide that perspective. And overall of the participants, it looks like about 2/3 are providing direct service, about 20% being involved in research and policy development and such, and then a handful that are doing other. So that's our audience today, to update the panelists, since I can see the poll and others can't. But I wanted to share that information as we launch into the core content. And this is the agenda for the session today. We'll briefly touch base about the importance of this topics within the contemporary context. We'll focus on prevention as well as intervention, postvention, really highlight the purpose of why we're developing this special topic section to be featured in School Psychology Review ultimately. We'll then after a bit of presentation on information about those topics, we'll briefly mention the types of manuscripts, the due date, which as you can see here is November 15th, 2020. For those of you that are interested in preparing a manuscript, that would be the due date to be considered for the special topic section. And we'll also have a little bit of time at the end for question and answers. And I encourage you, if you don't have enough time to answer your questions, to follow up with Rhonda, Tyler, Dorothy, or myself. Okay. So with that, we'll go ahead and launch in, and I'll turn it over. I think we started off with Rhonda here, right? And you're muted, sorry.
Yes, can you hear me? Yes. So sorry, I muted myself. So I want to talk about sort of the current trends and what's going on with youth suicide in our country. So as you see from the figure, suicide rates have increased over time, and they've been increasing over the last decade. And this has been a concern in our country as these rates are increasing. Currently, suicide is, as it says, the second leading cause of death, but it ranged from kids from 10 up into young adults at 34. So it was not always the second leading cause of death. And because it is now, there is huge concern about paying attention and how to prevent suicide. But one of the things about youth suicide is that we know that many times teens show warning signs. So there are behaviors that are exhibited in which we can detect. And as the statistic shows, 90% of those youth who die by suicide have a mental health problem. And that is something we also can identify. So it is very important for us to be aware that this is a significant problem and that we can identify behaviors, symptoms in which we can help to prevent suicide completions in this population. So next, I'm going to talk about the suicide crisis among Black youth, which I had mentioned I have been a part of a task force in which we address this. Some of the current statistics show that there have been increases, particularly in the rates of suicide completion in young Black youth. There was a data set run from the CDC in which they looked at youth across all ages, but one of the things they've identified is that youth between the ages of 5 to 12, so these are the young kids, that Black youth had almost twice as many death completions by suicide as white youth. And that was a surprise. When I saw that article, I was amazed and shocked and couldn't figure out sort of what was going on. And then there was a recent study that came out looking at the trends for the youth behavior, risk behavior survey, which is given to high school all over the United States. And it's given every 2 years, and they ask about a lot of different types of behaviors. They do also ask about suicidal ideation and behaviors. In their recent publication, they looked at from 1991 to 2017, they showed that Black adolescents were showing a linear increase in suicide attempts over the years. And for all other racial ethnic groups, there was a decrease over time. And so this sort of raised the issue of what is going on, what is happening with Black youth. And so it shows that we need to pay attention. Black youth has always been considered a population that we thought had low risk and for suicide. And so they weren't identified, but we need to pay particular attention because these youth are making attempts and completions.
Excellent.
So I'll kind of extend Rhonda's discussion by highlighting the importance of addressing suicidality among LGBTQ+ youth. And I should just preface this by saying that this is just one of the several populations. So Rhonda was mentioning the concerns about Black youth. There's several demographic and environmental factors that we know drastically increase the probability of youth that they're going to experience suicidal ideation, that they might make attempts, and that they would be completers, like Rhonda just mentioned. And so I just wanted to highlight this as it's some work that we've recently been getting involved with and is one of our more pressing concerns locally here in Utah. In general, what we know from the best population-based statistics we have is that sexual minority youth are many times more likely to experience suicidal ideation as well as to attempt. And we specifically have a concern with our trans youth. They're even several more times more likely than those who are cisgender identity. And I have a slide on that in a second. But I also want to just draw attention here to this little pie chart. I know it gets pretty small probably on your computer and you might not be able to see it well. But what this is drawing attention to is recent results from the Trevor Project survey of sexual minority youth, where they identify the need and the want for mental health services. And as we're thinking about the context of this special issue, which is on schools, just to put forward our position that schools are a great, accessible, public free option for receiving support and to also prevent suicide. What's striking, I think, about this figure is that if you put that 46 and 38% together, 46% wanted mental health services in the past 12 months but couldn't get it, and 38% wanted it and got it, that we see that we have over 80% of our sexual minority youth who are self-perceiving that they need mental health supports, which again, all of them cannot access and historically do not access mental health services anywhere outside of schools. So this is just a few highlighted statistics from the survey I was just mentioning. I really recommend clicking on this link here. I think we're going to send out the slides to you all, and there should be an active link on the Trevor Project, and you can follow the results. They have a nice interactive website that you can use or download the PDF. But again, this is not a comparison of sexual minority youth to sexual majority youth, but rather just focusing on the population of LGBTQ+ youth themselves. And it highlights the high rates of both considering suicide, which we have there in the darker bluish bars there, and then also attempting suicide. And you can see again the difference and the increase among specifically our trans youth and non-binary youth. And this goes across the board from from ideation to attempts and also to completion. So there's a lot of interesting data, and we really encourage for this special issue considering sexual minority youth and both assessment and prevention efforts for them, given the many risk factors that they experience and the potential for schools. I think I got another slide or so maybe on this, Shane. Another thing I wanted to highlight is, and what we would encourage for submissions is to also focus on not just national concerns, but also regional or local concerns. And so I thought it might be helpful to sort of just use some data that's really recent from a statewide survey of school-age youth in 8th, 10th, and 12th grades in Utah to just illustrate how we can not only be concerned nationally, but that there's also regional differences in these. So these data here are from a statewide survey called the SHARP survey. I don't recall what the acronym stands for, but it's a catchy name. And this follows the same cohort of kids in 8th, 10th, and 12th grade in the state. And it's kind of like our local version of the YRBS, if you want to get a feel for the types of questions it's answering. So to help you interpret this data, again, I know it's pretty small, but in the far left panel here, we have, did you ever, in the past 12 months, have you seriously considered attempting suicide? So this is active suicidal ideation. The middle panel is planning or preparations related to suicide. And then the far right panel is actually attempts of suicide. So this is just a specific subsection of gay and lesbian students who self-identified as gay or lesbian. And if you wanted to map this back to the previous slide, it would kind of be analogous to the cisgender rates on there. And what I would highlight, and it's hard to compare these slides without flipping back and forth, as you can see, for example, that our rates across our adolescent youth in Utah are about 10% higher in ideation or actively considering suicide when you compare it to the national rate. And then if you break it down by grade level, you can see that we have interesting regional trends in this data that suggests that actually our younger adolescents have greater risk across all of these three key indicators of suicidal behavior compared to our older adolescents. And this is something that we are trying to take to heart as we think about how we can specifically intervene in prevention in middle school, even though oftentimes we don't think about maybe gender identity or sexual orientation and how that might interact with suicidality until high school. So interesting regional data. If you see those little dots, the dark dots on there, those completed circles there are states average across youth, regardless of gender identity. So you can again see how many more times likely our gay and lesbian students are to experience suicidal risk compared to students in general. And then on the 10 and 12, there's a really small orange X there, and that's actually the YRBS average data. And so you can compare that and see again how Utah has even more risk than our national statistics suggest. The last thing I just wanted to mention is also just looking at trends and realizing again regionally that this does not only apply to states, but also just particular segments of the United States. So the data that I highlight here are actually not for youth specifically. They're starting in 10 years old and up through all adults. I couldn't find nice graphs that showed what I wanted to show with youth, but I would just say that the trends are very similar, although the numbers are a bit lower. And that what we can see here, if you look at this map of the United States, that in the Intermountain region where we live, which has the darker blue, we have much greater levels of intentional suicide and completions than in even other regions of the United States. And so we have a particular concern in Utah, Nevada, Idaho, Wyoming, Montana, and are trying to see what we can do regionally to understand these issues. So again, just another example of what we might consider and the different levels of analysis that we are very interested in as far as prevention goes. And then Dorothy, did you want to talk about this, or I can keep talking? I feel like
Sure, no, I'll let you take a break there for a minute, Tyler. So what we're going to try to do here is to provide some resources, as some of you may be out there practicing in the schools and doing your practicum and internships. And the National Association of School Psychologists have provided a number of resources for preventing youth suicide, and this is just one example that gives you some guidance in thinking about prevention, post-intervention. So you can go to the next slide.
And I think this is, I can toggle back to me on this one. As the title of the special issue goes, we're really interested in the spectrum of research and work from prevention to intervention, or what's happening when youth are actively suicidal, to postvention after the fact. And so I'll just kick it off with a little bit about prevention. There are multiple approaches, and the resources for prevention and suicidality in schools are really burgeoning over the last decade, which is fabulous. There's a general agreement that just like everything else we love doing in school psychology, that we should take a multi-tiered or public health approach to this work. And so I've included the triangles, which I'm sure you have all seen many times, and I don't need to spend time explaining, but that we can kind of scale our work by the level of the intensity that we're providing in our services, or the time and resources we're devoting to it, as well as the scope of the population. And so when it comes to supporting youth and preventing suicidality, we can think of it similar to we think of as how we might target academic success, or how we might target behavioral success, or other types of healthy living and development within a school setting. I've highlighted a nice article here that by Singer et al. That was just published this last year in School Mental Health, which I really recommend if folks haven't taken a look at it, that just walks through and provides a nice succinct summary of what a multi-tiered or multi-level prevention approach looks like towards suicide. They highlight a lot of the key programs, and those that we know are evidence-based, and those that have kind of an emerging evidence-based, or that are at least sort of based on evidence, which are all three very different levels of status of support. And I think on the next slide or so, I have some more examples of those programs. Lots of logos here. These help to illustrate the variety of different approaches for prevention work. These go from sort of the general crisis line approach, which the most common is a suicide prevention lifeline, which we would encourage you all to be providing to any client that you work with from the get-go, even if they're presenting with risk or not. There are also several different iterations and more regional versions of this. One to emerge recently is the crisis text line, which just allows people to get support without needing to actually talk to someone in person. And there's even more local versions. And so in Utah, within the past couple of years, our legislature has funded what's called the Safe UT app. And this is a smartphone app that youth can download on their phones, and they can get immediate text or phone access to licensed crisis counselors, which is a wonderful support. They have several other different programs that we're running just even in our state, and I've highlighted some of these nationally. And these kind of help to illustrate the different prevention approaches that might be considered in submissions. So Hope Squad is something that was originally, I believe, actually developed in Utah and has spread to a dozen plus states right now. And this is a school-based, peer-driven suicide prevention strategy that focuses on developing school leadership teams and increasing school connectedness and awareness and support related to mental health and specifically suicide-related issues. The QPR and mental health first aid are nice examples of the gatekeeper training, which can be very useful not only for educators and school administrators, but also for parents. The signs of suicide is an example of a much more intensive prevention programming where they're actually going in and doing what's more similar to like a conventional like SEL lesson format within classes, and actually doing direct psychoeducation and skills training with students. And the Columbia Lighthouse Project, one of my first personal favorites that we use in our work, has great tools that are available for screening that they differentiate and kind of adapt depending on what the caregiver or service provider's role is. So they have tools that are appropriate for teachers, for school counselors, for mental health professionals, for pediatricians, for other community-based supports, as well as for peers. And I can't recommend that resource enough. What we would hope to see is sort of a variety of focus on different prevention topics. And hopefully this kind of just helps to jog your ideas in generating what might be possible, because there's a lot of different approaches right now, and we need a lot more evidence on all of them.
And Tyler, one good question that was posted in the chat, just as it relates to where you're at right now, is whether or not the Safe UT is only for Utah, or is that for all states?
It is only available for our region. I believe it actually might extend up into Idaho. I can follow up on that and send out some information, but my understanding is that it's only available for Utah. It's something that's actually funded by our state legislature, and it's produced out of the University of Utah, their Neuropsychiatric Institute, and they're the folks who staff that. But I can follow up on that.
Excellent, thanks. Okay.
Yes, so I will be talking about intervention. And so one of the things that a recent review and meta-analysis showed that brief interventions can work. So this meta-analysis was done in acute care settings, crisis centers, emergency departments. It included both adults and adolescents in the studies that were reviewed. They identified 14 studies with over 4,000 patients. And the types of brief interventions that were shown were a brief contact, which could be a telephone call after someone leaves. It also included safety planning interventions in which you plan how a youth would be safe once they leave the emergency room or the crisis center. And also short-term interventions that could be done in one session, and also care coordination. So they sort of work on how do you get someone to their mental health appointment. And so these are things that are done briefly that can be applicable to more than acute care settings. That can be done in school settings in which you can be able to make sure you follow up with the youth to see if they got to their mental health appointment, make sure a plan for them to be safe in the school setting. So what they found is when they looked at these studies is actually that the rates of suicidal ideation behaviors decreased over time in their follow-ups, and they also increased linkages to mental health care across these studies. They did not find any association with depression symptoms, but not everyone who has suicidal ideation behavior has depression. But it actually worked on identifying the target suicidal ideation and attempts. So you can move on to the next. And so next I'm gonna talk about postvention. And so I wanted to talk about suicide contagion because that's an issue, especially when you're in the school system. Kids talk about things, social media, things on their streaming live. And so this study actually looked at what the crisis text line in which Tyler had just presented. And say they looked at a period of time in which several events happened. The release of the second season of 13 Reasons Why, which was preceded or was followed briefly by the celebrity deaths of both Anthony Bourdain as well as Kate Spade. And you see the bottom blue line, which is at the bottom, shows when someone who called identified suicidal thoughts in that discussion on the text. And the larger line was sort of just the volume of texts that came through. And so this population included both adults and children, but 55% of this population was 17 and younger. So the majority of these were youth. So as you see, after the 13 Reasons Why release, there was an increase in both text to the crisis line as well as suicidal ideation. And then there was even a larger peak after the celebrity deaths. And then they go back down. So this is identifying that when these events happen, the suicide contagion is happening. This is quasi-experimental, so there are ways that you can criticize the study, but it tells that when we're interacting with youth during these times, we need to be helping them process these events that are happening. They are aware and they're reaching out for help. And so as providers who work with them, we need to have these discussions and sort of help them so that we can prevent the suicide contagion that may occur.
So when we think of, there's lots of unanswered questions in this area. We definitely do know that youth suicide, more specifically, is a public health crisis. We're concerned about the demographics that both Tyler and Rhonda talked about, and even the intersectionality, right? So we would welcome some manuscripts that would consider Black queer youth and suicidality as well. But there's a lot of big questions that we have in the field as we move forward, and we're hoping that some of the manuscripts that you submit might address these of how do we provide culturally responsive screening and assessment of suicide risk? How do we create school policies to support students who may be at risk for suicide? Kids spend most of their time in schools. pre-pandemic, hopefully post-pandemic. How do we support students, teachers, and families when youth return to school after suicide attempt? And this is really, we need to think about the stigma associated with suicide attempts and hospitalizations, and families hold that stigma, but also our teachers as well. How do we support that transition back to school? What school-based programs are evidence-based for suicide prevention? And Tyler did a nice job of highlighting where the direction is going, and it really is, especially within high schools, looking toward the peers and the youth to shape school connectedness and promote help-seeking behaviors that's not seen as stigmatizing. And then finally, how can schools help reduce the mental health inequities that contribute to the higher rates that Rhonda and Tyler were talking about some of our minority students. And so many of you may have data sets sitting around and you're looking for an ideal home. This might be the special issue where you find that home for that data set to answer these big questions.
Excellent, thank you. Wow, some really great information, and seeing a lot of appreciation in the chat there for the panelists' information that they're sharing regarding the importance of prevention and intervention and postvention. I know that this slide will be difficult to read on all your screens, but the real purpose is just to highlight that these are just a handful, maybe 10, maybe a dozen articles that have been featured in School Psychology Review, as was noted by Dorothy, Tyler, Rhonda, the importance of our efforts in working to support youth, where most children, most days when we're not within the COVID-19 context, are at school. And so the school context does present a tremendous opportunity. And even though students are not presently in school, I might suggest that it's even all the more important that we're able to work with our education colleagues and professionals to help navigate, facilitate the appropriate screening, perhaps universal screening that's implemented in some districts, in some regions, in some schools, perhaps the importance of doing mental health awareness, suicide awareness, and really having our educational colleagues be aware of these dynamics that so many youth are experiencing. And again, especially now during the COVID-19 context, wherein there are many youth who are especially isolated, and especially, again, it's unfortunate that they refer to it as social distancing, because I think physical distancing would have been more precise and more accurate as to what we're attempting to accomplish. But from the very beginning, when they suggested social distancing, I thought to myself, wow, for adolescents and for most children and for most people, we're social creatures, we're social beings. And especially with that distance remote learning, I just see this as such a critically important topic. While we are away from each other, while children, many children throughout the country are not seeing each other each day or going to a school physically. Some are. It's critically important there as well. But so I just wanted to highlight that School Psych Review has published a series of papers over the years, and suicide prevention being a primary focus, those evidence-based interventions within the prevention programs, but then also mentioning studies that focused, for instance, in Florida on the sustained reduction of youth suicidal behavior in an urban multicultural school district, and really the importance, as Rhonda was highlighting, about the importance of cultural and diversity considerations in our efforts. Each of the presenters had expressed the importance of these topics. So again, I just mentioned some of these as papers within School Psychology Review previously, but even more exciting is some of you might want to submit to the upcoming special topics section. And then in 2021, when we're featuring those new publications, my hope is Rhonda, Dorothy, and Tyler will come back together and we'll be able to have another SPR Zoom webinar that basically we're able to present some of those key findings. Maybe even some of the authors will be doing special topic sections. And again, just to highlight, we are doing SPR 120-second summaries where authors present their information, their key questions, key findings, and key implications for science and practice within the SPR YouTube channel. So look ahead for that as well. So this is a little bit about things in the past, but there's things on the forefront. Okay, I'll put up the poll real quick. This is a chance to kind of check in here. We've been going long. A lot of you are able to fill that out. Wow, it's rapidly going up. Okay. Well, with over 200 responses in the last 10 seconds, just right, thank you, is coming in at about 98% of the respondents. And a couple too fast, a couple too slow. There's always those outliers. We get that. And I think we're in a good pace here. So thank you for the feedback in the end there. That was really great. And we've got a little bit more information here in the next segment. And then we'll also have opportunities to answer some of the questions. I see that Tyler, for instance, has already started to provide some responses within the chat. I've been trying to provide links to some of those HTTP of things that the YRBSS and other sort of Utah information. So tried to include information in there, but this is also a great time as we're going to present for the next 5 minutes or so on some key details about submitting articles to School Psych Review for the special topic section. This is also a great time to go ahead and post your questions right in that chat, and that will give the panelists a little bit of time to be thinking about it, right? So that they can provide you with a clear, succinct response with over 300, 400 people participating. There's, probably a lot of different questions, a lot of different information that folks might want. So go ahead and post in the chat and we'll share a little bit of information, a little bit more information here. Okay, I'll end that poll so it gets off your screen. I think that worked, yeah. Okay, in terms of the types of manuscripts that are encouraged, I know that each of the panelists had each shared a bit of information broadly, but I just want to highlight that each of our colleagues here, both as the guest editors that are leading this, as well as our editorial board members, really do embrace the range of various methodologies. So we want to highlight that if you're doing that qualitative work, if you're doing the quantitative work, if you're doing mixed methods work, that these types of empirical investigations will be given highest priority. So if you are engaged in scholarship activities, research, evaluation, and you have qualitative, quantitative, or mixed methods, empirical investigations, those will certainly be given top priority. And as Dorothy mentioned, perhaps you have some data that you haven't looked at in the way that we've been talking about it today, and that could be really valuable to do analyses on secondary data analyses on larger data sets that help to answer some of these questions, those big questions like Dorothy was outlining, and really advance our knowledge and understanding. We want to focus on advancing science, practice, and policy related to this topic, as we do with all topics in School Psych Review. But again, think about that, right? We want to advance the science, we want to advance the practice, and we want to advance the policy. Also, as was noted, we welcome meta-analyses or particular integrated data projects. That's super exciting. And clearly, there's great need for contemporary meta-analyses related to youth suicide, prevention, intervention, postvention in multiple areas, especially some of those that Tyler was and Rhonda were speaking towards about addressing diversity, and LGBTQ plus youth, really thinking about these critical topics where if we looked at the breadth of this existing literature and science, what could we yield from that? So we would certainly welcome those also. And then of course, systematic reviews. And systematic reviews, it's just important to mention, like we emphasize the PRISMA guidelines that sort of help to illustrate running a systematic search process, identifying those potential articles based on a systematic process, and then those that are included, those that are excluded, and really having those systematic reviews be quite rigorous. So for those of you who, especially students and teams out there, research teams that are plowing through a lot of literature as you're developing your projects or theses, and you've done it very systematically, and you can document that as with those types of PRISMA guidelines and such, that we certainly welcome those systematic reviews as well. And then also, as we've been talking about this today, you can see that there's great needs for continuing development of theoretical and conceptual foundations to inform our science, to inform our practice, and ultimately as well inform our policy. So we would also welcome those theoretical or conceptual papers in addition. Dorothy, Rhonda, Tyler, I don't know if you had anything more to add to that or if we're good. Okay. All right. And in terms of when they're due, November 15th is the deadline for submissions that would be able to be considered within the special topic section focused on youth suicide, addressing youth suicide through prevention, intervention, and postvention. And typically, if it ends up that it's going to be a couple of days late, we're able to make those types of adjustments and such. But in general, have your team focus on November 15th. This timely submission then allows us to complete the review process, which, by the way, right now on our submissions to date, which we've managed about 125 submissions just in the past 3 months, we're averaging around 19 days from submission to decision. Now, granted, when there's so many during a small period, Dorothy and Rhonda and Tyler and I and reviewers, editorial board members will be very busy. But we're turning these around in less than 30 days. And as I just shared, presently averaging 19 days across the first 125 or so manuscripts. So November 15th, rapid turnaround, rapid review, high quality, constructive feedback. That's our focus. Kind, really acknowledging the amount of effort that it takes. And at the same time, recognizing that not all submissions will be a great fit to be featured in school psych review, but we want to provide respectful, constructive, and thoughtful feedback that's kind to each of the authors that do submit. So you can submit right there on Taylor and Francis online. USPR, all of the Taylor and Francis journals have the letter U before the journal acronym, so that's why U is in there. It's not trying to be special about US. If you are an international colleague or you have collaborations or data, this is a topic clearly that warrants our collective efforts throughout the world. There's many transnational considerations and such, so it's not meant to say US, it just happens to be the letter U. So USPR after TNF online, and you'll see a screen that looks like this. Most recently, impact factor sitting at 2.3. That'll continue to go up, we anticipate, given the high quality contributions of scholars. And I will note that down below, to get access, you can see that there's a way that you can click on addressing youth suicide through prevention, intervention, and postvention, which will provide you with all of the submission details and such. So that's what you'll see when you go to submit. If you'd like to get automatic updates, you can just click on content alerts, the new content alerts, and you can basically subscribe to School Psych Review, where every time a new article is posted online first, which is within 30 days of receiving the acceptance, that new content that's featured, it will just send you an email and then you can see it. Now, it will be the case for these special topic sections that will keep those embargoed as a collective. So we won't be releasing them one and then another, but we'll keep those. But when the special topic section's released and you've got all this great new knowledge about addressing youth suicide, it would be sending you an automatic update just saying, hey, here's the new issue that's available. You can click on these links. Okay. So that's the brief details there. And I think we're in really great timing for questions and comments. And again, those of you active on social media, you'll see that there's been about 10 posts, 10 tweets that have gone out from the @SchoolPsychRev Twitter. And it's featured a lot of the key slides and key points that have been made. I see a few folks raising their hand, and I'm not sure if it's easy for you to type in a comment here, but I can try to also navigate how to see or call on you or allow you to speak. But I see that there's a few hands. I think it was Liz. But let's go ahead and open it up for questions. And Dorothy and Tyler and Rhonda, I think you've also been able to look. I know folks have been sending out, I see some key links and such. But maybe Dorothy or Rhonda or Tyler, if you identified, while I'll also look at this, a couple of key questions that we might speak to and provide a little bit more information.
Yeah, so Rhonda just responded to Sarah. So Sarah had posted a question, would we welcome abstracts to see if the manuscript would fit? Absolutely. Send your abstract along, we will review and give you kind feedback of whether or not it fits into what we're envisioning for the special issue.
Excellent. Are there any others that were posted there that you'd like to speak to? I know Amanda had asked if there will be a recording that's available after. And yes, I know that if you join after a certain point, it doesn't let you see the previous chat or whatever, but I will post it again, indicating that this session has been recorded, and we will then post it on the School Psych Review YouTube channel, such that if you came in late, you could watch the whole thing, or if it was a little bit too fast of information presentation, you can go back and watch it again. Or if you wanted to share it with your friends and colleagues or peers, you're welcome to. You can also use these presentations in your classes, perhaps for presentations or to further engage students, colleagues, practitioners, whomever. Yeah.
Yeah, there was also a question, I think it was from Carly. Yeah, Carly said, is there a need for exploring risk factors of youth suicide, including anxiety? I think so. And I think, and I'll let Rhonda and Tyler add to this, but I think we also need to understand the unique risk factors for some of the understudied populations. And so that would be important too. And I think because when we think about youth suicide in schools, you know, schools have changed quite a bit. So I think it is important to understand the contemporary predictors, both risk, but also a focus on protection as well. I think would be excellent to understand that in the light of risk, what is protective of eliminating that trajectory towards suicidality.
Those are excellent points. Yeah.
I
What do you
think on
think,
that
Tyler?
point, I kind of think of it as, you know, we could break it down into maybe two different types of research. We have sort of our applied research where we're actually looking at tools and protocols, interventions, and we're very interested in that. And then we also are interested in what might be basic research, which is a step removed prior. And that's the type of research that will then inform our applied research in the future. So the more we can learn about risk factors. I saw another question there that someone had posted about traits related to predicting suicidality in caregivers, I believe. All these sorts of things are potentially relevant in that they can inform our applied research. And we're interested in both domains, I think.
I agree. I mean, I think particularly looking at the sort of populations, what may be unique about risk and protective factors for these populations is what we don't know a lot about either, about whether sort of the general risk factors apply and do they apply across gender and age groups, especially with these younger youth being at risk for suicide completions. Their risk factors may be different than adolescents. And so I think these are the things that we need to consider, this intersectionality more.
Excellent points for certain. That intersectionality piece, so critically important, and us thinking about that as, that's for all of us, right? For students, for practitioners, for scholars, like we really need to get our minds around this topic to do good work and support children and such. So important. I did share that there's a link to the meta-analysis that Dorothy had done that's focused on suicidal thoughts and behaviors among LGBTQ youth. That's a meta-analysis that was just published in 2019. Some of you might be interested in that as well. Okay, and we've got a few more minutes here so we can look at a few more of these questions. Let's see. There was one from Sarah or Sandra that said how to provide support to your own family members who may have attempted suicide or expressed ideation. Are there particular kind of evidence-based, science-focused responses that either of you have about that?
I mean, one of the things I think is important is to make sure that if anyone you know's family member, peer, friend, to make sure they can get connected to mental health treatment. That's one of the important part. Also sort of identifying a way that they can stay safe. I mean, you could be the person which they can come to when they're upset, but you want to make sure they're linked to a mental health professional to kind of address these issues long-term and ways to support them, helping them go to the first appointment with them. So those are things that you can do. And checking in on them to make sure they're okay. Many times people may withdraw and you may not know what's going on.
Excellent.
Yeah, I think would chime in on that and say it's the same strategies that you would use to support a youth that was your client, right? It's just more personal, and therefore sometimes harder to use those strategies with fidelity because there's lots of relationship dynamics or maybe emotions that prevent us from doing things the way we're trained to do it when we're interacting with our family. So I think following up on what Rhonda said, just helping them develop a safety plan. But even before that, making sure that you immediately refer them to professional mental health supports, because that's probably the most important thing, because ethically speaking, you should not be the one who's taking on the obligation to handle that. It's very important that you be positive social support, but you should not be the mental health professional in that situation. But helping them create a safety plan if they don't have access to a mental health professional, making sure they have these resources for the suicide prevention lifeline, the crisis text line, or the Safe UT app if you're in Utah, and that they have access to just the many free and especially online resources that are available for immediate crisis support. I think especially folks who are experiencing suicidal behavior, they find a lot of benefit from accessing resources and support that they don't have to do direct social confrontation in order to get. And we have so many of those now.
Excellent. Another question that just popped in there. I know we're just about out of time, but we have a couple more minutes. So as long as we've got these panelists here with us, let's ask this question. Other than the YRBSS, are there any other screeners or brief interventions that are particularly useful or newly implemented in schools specifically?
Shane, did you put the link for the Columbia screeners in there?
Oh, I don't think I did yet, but I will do that while you're sharing if one of you want to speak to that.
Yeah, so I mentioned the Columbia suicide severity rating scales before, and this is what we most commonly use in our training in our local schools here. It's a good question, I think, highlight the differences in screening. So the YRBS or like the Utah State SHARP survey that I discussed earlier, those are population-based screeners. They're given to large samples of youth and they're typically anonymous. And so there's no way of actually like following up with those youth or using them to identify risk and then to follow up with like another targeted screening or a referral for supports. And so the instruments that are used for actually screening for suicide risk in an identifiable way are usually a different set. The Columbia one is the one that I prefer. It's what we use there's a self-report format, and you could actually have every youth in the school complete the self-report. There's also different versions of the rating scale that are available, like I said, for school counselors or for other mental health professionals or within primary care settings. And I think there's a good evidence base to support that screener specifically. So that's sort of my go-to. I don't know if Rhonda and Dorothy have others that they would like to mention.
No, we use Columbia. I'm in a medical setting, but we use the Columbia. Other people are using, there's some other, the ASQ people are using sometimes. I know they're using them in our emergency room now. So there are other screeners or assessments that you need to figure out probably what's applicable to your population too, and sort of, and how to train the staff to administer it and what will be the follow-up. So really setting up procedures or both identification and sort of follow up and what happens afterwards.
Excellent. Well, we're just out of time, but I want to, before we conclude here, I do want to express tremendous gratitude to each of our panelists who joined us today for all of your efforts, both in terms of the research that you've been doing, what you've contributed, the work that you're currently doing, as well as the work with individuals and students and children and youth and families. So important, as well as the real strong focus on bringing this science to practice to help support children and families. So critically important. And this special topic section that will be forthcoming will be so incredibly valuable to help continue to advance the science, the practice, as well as policy related to youth suicide. I put up the post to say, was it helpful for folks there with the poll? And I can tell you that we've got 93% of around a couple hundred who have already, more than 200 who have already responded. So yes, it was fantastic. For those of you who are seeking more information, please do follow up. Each of these individuals are quite easy to Google. They're active on email, and so you can find them in terms of easily just Google and be able to email them if you have additional questions. And just again, tremendous gratitude to each of our presenters. We appreciate each of the participants, students today, again, faculty and practitioners, as well as other administrators and others who took your time today to participate in this important SPR Zoom webinar on youth suicide. So thank you, and I hope that you enjoy the rest of your day and look forward to further communications and collaborations. Thank you.
Thank you.
Thanks
Bye,
all.
everyone. Have a good day.
Bye-bye. We'll stop recording.